Think not getting the COVID vaccine is a personal choice? Well, if you ask patients who are not able to get their surgeries because the hospitals are full, they'll tell you, think again.
Public health and public safety trumps your personal choice.
My knees are totally bone on bone, kneecap bone, so that's what's tough.
And it turns out there's another reason our hospitals are struggling so much right now. Oregon apparently didn't have that many hospital beds to begin with, which was working out just fine until the pandemic hit. Also, we should check in on the Newburgh School Board debate over the ban on Pride and Black Lives Matter flags.
I'm gonna cut this off, Dave.
No, you're not, Brian. You're not cutting it off. Rebecca has a question.
This off.
How are you cutting this off?
Sounds like it's going just about as well as expected. Here's the story.
How are you cutting this off?
Welcome to The Story. I'm Pat Doris. Dan's taking some well-deserved time off, so I'm here for the next couple of days with you. This is still the same show. It's all driven by your feedback, and all the ways to contact us are right there at the bottom of the screen. You can email us at thestory@kgw.com or use the hashtag HeyDan on Twitter. All right, let's get started. All across Oregon and Southwest Washington, thousands of people are getting phone calls now and learning the surgery they've waited months to get is canceled. They're being canceled because the hospitals are full of mostly unvaccinated COVID patients. The surgeries are called elective, but they're not to those who need them. We thought that you should hear from some of those people. Oregon's major hospitals do hundreds of surgeries a month in normal times, but of course these are not normal times. Hospital space is tight and reserved for emergencies and COVID patients. That means people like Paul McElhenney, a school bus driver who lives in Tigard, has to live with his knee pain.
My knees are totally bone on bone, kneecap bone, so that's what's tough.
His knee replacement surgery is on hold. Christy Finn of Milwaukee needs surgery on her stomach.
But basically, my stomach is dead. And so they're going to have to remove it. And I've been on a feeding tube since April. I can't have any solid food. It's all got to be liquid.
Her surgery also on hold. She's losing her sympathy for those who will not get vaccinated. The majority of people currently hospitalized in Oregon for COVID are not vaccinated.
I'm frustrated. You know, it's all could have been, it's preventable. It's preventable. I mean, at first I was very sympathetic and I'm sorry that people are sick and that they're dying, but there's others of us out there that I'm immunocompromised. I mean, I have other conditions going on.
Barb Russell in Central Oregon has a racing heart. It's called AFib.
AFib is when your heart beats irregularly and the blood then coagulates into the atrium. Then when the heart finally calms down and gets back to normal, it can pump out blood clots. And those can cause strokes, death, whatever.
Her procedure also postponed until, well, she's not sure when. After the COVID surge quiets down, probably.
Yes, it upsets me that people are protesting, don't get vaccinated, don't wear masks. Well, I'm sorry, you're messing with my life. So I'm bitter.
You are probably noticing a pattern here, and truthfully, we could keep going. Melanie Johnston from Cornelia spent 2 years searching for a solution to her lower back pain. It was going to be surgery until it wasn't. And Sherry Young, who needs a hernia operation to relieve her pain. When you hear about elective surgeries, this is what we're talking about. They are 5 of thousands around Oregon, suddenly shut out of surgeries that would relieve their pain and suffering, the victims of others' choices, and they are not happy.
I feel I've done everything right.
The pain is impacting my life.
It's preventable.
People are just not educated on the situation.
It seems like it's impossible. I don't know. It is frustrating.
The hospitals are cutting back on the surgeries because in some cases the patients would need to recover for a night or two and there's no room. Some day surgeries are also canceled because those recovery rooms are being used for COVID patients. And even where there might be an open bed, there are not enough nurses and other medical workers to care for the patient who would be put in that open bed. As the days go on, Desperation grows for some. In Sisters, Oregon, Gerald Schoaf just hopes he can keep walking. He has MS and his spine is degenerating.
There's multiple surgeons, and they're going to go in my front, my back, and my side.
He's been active most of his life, but now with his surgery delayed, he's terrified of ending up in a wheelchair.
Definitely, yes.
It's the sort of future that can move a strong man to tears.
Sorry, I get emotional about it. It's frustrating, though.
He has seen the protests against vaccinations and people proclaiming it's their right to skip the COVID shot. But he's also felt the impact of those personal choices, which now have delayed so many surgeries, including his. And he is out of patience.
Early on, I was kind of passive. Now I'm getting angry and disgusted. Really, I am.
A happy update, though. Late today, I got an email from Gerald's daughter. He had called his doctor to ask some questions and mentioned he'd done an interview for our story here. Well, guess what? They called him back and asked if he could come into the hospital today to get prepped for his surgery. All right, let's keep talking about hospital capacity. I want to revisit a question we got from a viewer named Celeste. She wrote, yes, hospitals are full, but have we talked about the fact that Oregon has the lowest hospital beds per capita in the U.S.? Celeste, you're right, they are full, and you are right, we're not talking about it enough. So here we go. This is a list from the Kaiser Family Foundation of hospital beds per capita in each state, the data from 2019 before the pandemic hit. You can see at the very top there, South Dakota with the most beds per 1,000 people, but then scroll all the way down to the bottom, and you see Washington and Oregon tied for last place. How'd we get here? Well, I checked with the Oregon Association of Hospitals and Health Systems. They say it all started back in 2012 after the Affordable Care Act was signed into law by President Obama. That allowed then Governor John Kitzhaber to create what are called coordinated care organizations. Those are groups of healthcare providers focused on helping people manage and prevent chronic conditions and diseases here in Oregon. The idea is to stop people from needing hospital care in the first place. So because of that, the state regulates the number of hospital beds, so there aren't a bunch of empty ones sitting around. If a hospital wants to expand, the state has to make sure the extra beds are actually needed in that area before signing off on it. Dave Northfield from the association told me this system works great until you have a pandemic combined with a hospital staffing crisis. The system created one of the lowest per capita hospital bed numbers in the country, and it used to be talked about with pride. Now we know it can be a problem. Now, we should mention adding more beds right now won't necessarily fix the problem we're having during the surge. Beds need to be staffed by workers who can actually care for patients. And, you know, as Dave mentioned, there's a big hospital staffing shortage in Oregon. To make matters worse, the Oregon Nurses Association has warned the state's vaccine mandate is going to contribute to that shortage. Healthcare workers in Oregon are required to get the vaccine by October 18th or be fired. Well, Peace Health, which has medical systems in Cottage Grove, Eugene, Florence, and Springfield, had an even earlier deadline this past Tuesday. And the Oregon Nurses Association says more than 100 Peace Health nurses are now on unpaid leave because they have not gotten the vaccine. Some workers staged a protest outside Riverbend Hospital in Springfield this week, leaving their shoes outside the front entrance. Speaking of vaccines, let's count some. More than 2.7 million Oregonians have gotten at least their first dose. That's a little more than 64% of the state's entire population. We're counting everyone, even kids under 12 who cannot get the vaccine yet. In Washington state, more than 5.18 million people have gotten at least their first dose. That works out to a little more than 68% of the state's entire population, including kids. School starts in Newburgh next week, and right now, staff members are still banned from displaying Black Lives Matter and LGBTQ pride flags and other symbols at the school. The Newburgh School Board last night voted to keep a ban in place for, quote, divisive political symbols, despite mounting legal pressure against them. The board voted 4-3 last month to ban the symbols in the schools. That caused an uproar both here in Oregon and across the country. Currently, the ban is technically in place, but there are no specific rules or guidance. There's also plenty of legal trouble brewing for the school district because both the ACLU and the teachers union say they intend to sue over that ban. Well, last night the board met again, this time to rescind the ban, but it's not quite that simple. They want to rescind the ban so they can come up with a more permanent solution by sending it to the board's official policy committee to rework it. The school district's lawyer advised them the ban is illegal But board vice chair Brian Shannon, who initiated the ban, hired an outside lawyer who said, no, the ban's just fine. Let's take a look at last night's meeting.
I mean, if you have an intent to rescind it anyway, it's not something that can be legally enforced at this point. Why are you trying to hang on to not rescinding it tonight?
Well, I disagree that I think it can legally be enforced. And it's the express will of the board as it has passed it. And I think it remains that way until we replace it.
So you're suggesting because you think it's legal that it should be enforced regardless of any legal advice we've gotten or lawsuits that we have pending?
I think that the motion is enforceable if certain parties wanted to enforce it.
I disagree. I think it would be breaking the law.
It would absolutely be breaking the law. And we've heard this. And we've heard this from multiple sources, and we have multiple lawsuits waiting to happen.
Boy, that was a long pause in the middle of that, wasn't there? There's some tension there. The same board members who voted for the ban in the first place voted to table the motion to rescind it, meaning that nothing changes for now. And here's the thing. Even if the ban did make it to the policy committee, don't expect much to change. The committee is made up of 2 board members who are in favor of the ban and only 1 who's against it. And oh, by the way, they're not planning to change those assignments anytime soon.
I don't believe it's appropriate for members to question the committee assignments.
Why not?
That's never been done before.
Yeah.
Yes, it
Yes,
has.
it has.
Yes, it has.
It is entirely the chair's prerogative to assign committees. I'm gonna cut this off, Dave.
No, you're not, Brian. You're not cutting it off. Rebecca has a question.
Cutting this off.
How are you cutting this off? How are you cutting this off?
Just like that. Now, the question is, with school starting next week, how will a ban that's currently in place be enforced? Well, the original vote directs the superintendent to immediately ban the BLM and pride symbols, but the superintendent has said he's not going to do that because he's been advised it's illegal. We spend a lot of time telling you about climate change, but instead of just talking about it, let's show you some of the actual impacts we're seeing right now. From raging wildfires,
the fierce nature of the Caldor fire coming down the hill,
to historic flooding.
Sea level is going up across the entirety of the U.S. coastlines.
When the story continues. Welcome back. Hey, we always go through your questions and comments during the break, so keep sending them in to thestory@kgw.com or use the hashtag HeyDan on Twitter. I also want to remind you about our Hey Help campaign. This week we're asking you to consider donating to the Milk Crate Kitchen. They provide families in need with free meals. It was started after a Portland chef lost his job during the pandemic. If you want to help them out, it's real easy. Just hold out your phone's camera up to the QR code there, and it will take you to a donation page. You can also go to kgw.com/heyhelp. It's been almost exactly a year since the devastating wildfire that spread across Oregon in September of 2020. Thankfully, we are not dealing with that right now, but other places in the West are, like Lake Tahoe, where I'm sure a lot of you have been. We sent Devin Haskins down there to the Caldor fire burning in Northern California.
Pat, the Caldor fire is one of California's largest fires in its history. It started over 2 weeks ago and has grown to more than 200,000 acres. One of the biggest concerns was the fire engulfing the tourist town of South Lake Tahoe. Earlier this week, more than 21,000 were evacuated, along with tens of thousands of others in the fire's path. The fire is just a few miles south of the lake, and so far has left both the city and popular ski hills alone. My photographer Chad and I have been here for the week, and let me tell you something about covering fires here in California. Unlike Oregon, journalists pretty much have the same access as firefighters do. The fierce nature of the Caldor fire coming down the hill, dangerously close to this house right here within feet. But what's actually working for this house right now is the defensible space here on the ground. You can see the path carved out right there. It's about 8-10 feet away. But the wind is actually pushing the flames up the hill, and firefighters say that's actually helping it slowly burn down. We came across this fire crew keeping the flames off this cabin in the Myers area south of Lake Tahoe. And as of Wednesday evening, almost 600 homes have burned. The fire crews are doing everything they can to protect them. More than 4,000 crews are fighting the Caldor fire. It's one of the many burning in the state. This just goes to show the dangers crews face. A piece of burning tree falling as hotshot crews were below. Get out of there. With Lake Tahoe being a virtual ghost town and the only people are fire crews, police, and the media, that gave this bear free rein to eat whatever he wanted at this Tahoe car wash. High winds were supposed to sweep through here, putting thousands of homes at risk. But firefighters say the winds weren't as bad as anticipated. Say they felt like they dodged a bullet. Now there's still plenty of work to do. The fire is only about a quarter of the way contained. It will grow larger, and right now it's encroaching on the California-Nevada state line. They expect the fire to be fully contained, not for another 2 weeks. Pat, back to you.
Thanks, Devin. Now let's turn from fire to water and another growing threat of climate change. This is something those of you living on the coast are really going to want to pay attention to. Coastal communities across the country are already feeling the effects of rising sea levels. Our Verify reporter, Gabe Cohen, traveled to Virginia to get a firsthand look.
As I sat with Karen Spates on her porch in Norfolk, Virginia, it suddenly started to pour, and her street and driveway began to flood.
How's this for a storm? Nothing.
She's used to this nuisance flooding, living along the Elizabeth River in southeast Virginia.
Have you seen it get worse throughout your life?
I have. And to be honest, I didn't pay that much attention to it.
But now a heavy storm at high tide can leave a foot of water in her home.
It's almost like it has to be the perfect storm. That's when I'm afraid.
So let's verify. Are rising sea levels threatening coastal communities in the U.S.? Our sources, 2 oceanographers, Norfolk, Virginia's chief resilience officer, a climate change nonprofit, and 2 homeowners in Norfolk, Virginia.
Are sea levels rising right now?
Sea levels are rising.
William Sweet is an oceanographer with NOAA.
Sea level is going up across the entirety of the U.S. coastlines.
Ben Hamilton heads the NASA Sea Level Change Team. Both agencies monitor sea levels using tide gauges, a century-old technology, as well as satellites. Their data show the sea level along parts of the east and Gulf Coast is rising an inch every 5 to 7 years.
What's causing this?
2-part ice melt, 1-part thermal expansions.
Global warming is melting glaciers and sea ice, adding water to the ocean. And the ocean is absorbing excess heat from greenhouse gases in the atmosphere, causing it to expand. And on top of that, the land in some coastal areas is slowly sinking.
Flooding that used to not occur now is occurring on sunny days.
And with the warming climate, sea level rise is expected to accelerate and cause 5 to 15 times more flooding in some areas by 2050.
When you have that larger sea level, the impacts of a storm is certainly going to be that much worse in the future.
40% of the U.S. population lives in coastal counties, and a 2019 study found sea level rise could displace 13 million Americans by 2100.
Unless we do something about it.
So we came to Norfolk, Virginia, a city making urgent moves.
Here in Norfolk, the water is rising faster than anywhere else on the East Coast, up 1.5 feet over the past century, and expected to rise another 5 feet by 2100.
Where we are standing safely, in coming decades, we'd be standing with waders on in the same spot.
Skip Stiles heads the nonprofit Wetlands Watch. He showed us the Larchmont neighborhood, where streets flood on sunny days.
Well, usually they're fishing here, but I guess it's been too hot lately.
During storms, homes here are often damaged, and roads are impassable for emergency vehicles. FEMA has helped elevate around 25 waterfront houses in this upscale neighborhood.
We're preserving the lifestyle of folks here, but at some point it becomes untenable. And when that is, who knows?
Norfolk has 10,000 homes in a severe flood hazard area.
So that's why we're trying to stay out in front of the problem.
Doug Beaver is the city's chief resilience officer. They've launched one of the boldest resilience plans in the U.S. to combat rising sea levels. They've nearly finished this 11-foot berm and 2 pump stations protecting the Chesterfield Heights neighborhood, paid for with a $112 million federal grant. And it's just the beginning. They want to raise the downtown seawall, build new barriers, elevate roads, and improve the city's stormwater system. They plan to spend $1.8 billion in the coming decades.
Norfolk alone won't be able to carry this burden.
A study from the Center for Climate Integrity found fortifying all U.S. coastlines with seawalls could cost $400 billion by 2040, with $30 billion just for Virginia.
At what point is it more cost effective to try to help people retreat?
There'll be places where we think that managed retreat will be the right solution. There'll be areas that we think elevating homes will be the right solution. And there'll be places where we think projects like this will be the right solution.
FEMA and the city have only bought out and demolished 3 Norfolk homes so far. They were all on this block.
Did they make you an offer?
They did, yes.
Joe Sleeper owns the next house over. He turned FEMA down 3 years ago to avoid a financial loss. But now he'd reconsider.
It would be easier than trying to sell it.
There are nearly 1,000 Norfolk homes on FEMA's list of severe repetitive loss properties. Karen Spate's house is one of them. She grew up here and now lives with her 93-year-old mother. They've suffered 3 severe floods. She now pays $400 a month in flood insurance.
How difficult is that?
It's very difficult. I could not sustain that amount.
The only way to drive down the cost is to remodel.
Did you think about selling?
Property value has already gone down. What would I sell it for?
So she just took out a $100,000 loan to fortify her house instead.
The flood insurance should go down.
She says the home just needs to survive her lifetime.
I believe with the work that I'm doing that I can be here 30 years.
Karen may be a good fit for a new program in Norfolk. It offers incentives to developers who want to build in safer areas if they buy out vulnerable properties and put the land in a conservation easement. The homeowner gets paid and can stay until the house floods or the water level gets dangerously close. Then the home gets demolished.
I can tell you people who have this situation, if somebody comes along and offers you some cash money so you can get out of your house, you'll take it.
But the city stresses there are no plans to flee the waterfront.
Well, this project right here will last this community 80 to 100 years. So we would hope that we will get to a tipping point of that curve not continuing to rise.
So you're hoping this will buy you enough time to actually fix the problem of rising sea levels?
Yes.
So we can verify, rising sea levels are threatening millions of Americans in coastal areas, and some cities will need to spend billions of dollars in the coming years to protect their communities.
I can't run from this. I have to do something. And if it doesn't work, all of us are in trouble.
With your Verify, I'm Gabe Cohen.
All right, keep sending your questions and comments to the story at kgw.com. We're going to finish up right after this. Before we go, I do want to mention that today is the final day of the KGW School Supply Drive. This is a look at volunteers from Schoolhouse Supplies, On Point Community Credit Union, and Safeway, sorting through the donations you have made over the past month, and we thank you. We collected enough cash and supplies to help, get this, 20,000 local students.
As everybody knows, this year looks a little bit different. It's a little bit tougher, and so it really means more to us this year to be part of this than ever before.
Want to get in on the action? You can still donate for just a few more hours. Just go to kgw.com/school for all the information. All right, let's read some of your comments. Eric wrote in, please remind everyone that kids are back in school. I saw drivers on Southeast Stark completely ignoring kids trying to cross the street for school. It is that time of year. Thank you, Eric. That's a great reminder. Cecilia sent us an email after my story about elective surgeries being delayed. She wrote, elective surgeries like liposuction or breast augmentation. Why are they saying these serious surgeries are elective if it's life-threatening? Well, I hear what you're saying. It is kind of confusing, but elective just means it's not an emergency surgery, not that someone's choosing to get it. So that can include things like cancer surgery, heart surgeries, things that are serious but not immediately life-threatening. And then Stephen wrote in, hey, Pat, I've enjoyed watching you host. I'm excited to see how you're going to sign off tonight. Thanks, Stephen. I'll sign off by saying that's the end of the story. I'll see you right back here tomorrow night.